Welcome to Emergency Chaos, where we provide tips and tricks to make you a better ER nurse. Today, we are going over how to prepare for an incoming cardiopulmonary arrest. Thank you for joining. Typically, you're going to get a heads up that a full arrest is coming to your room with an ETA. Ideally, you have plenty of time, but the ETA can range from 1 minute out to 10 to 15 minutes. But the priorities for getting everything ready and preparing remain the same. As you know, we are an advocate for being proactive, so your rooms would have been ready for action, meaning your rooms are stocked with suction supplies, BVMs, cardiac monitor supplies, IV supplies, pumps are readily available, the glucometer had been checked, and so forth. You stay prepared and you stay ready. Your flexibility and adaptability as an ER nurse will shine when getting a full arrest, especially depending on how much staff is available to assist. I've had codes with plenty of staff for all related tasks, and I've also been part of codes where it's just been an RT, a tech, the provider, and myself. So if staffing is slow, you'll find yourself performing many of the tasks that would have been delegated. As a way of preparing, you also need to take a deep breath and try to remain calm with a cool head. I know how nerve-wracking it can be, especially in the beginning. Your heart's going to be racing. You may even feel a little bit anxious. But again, take a deep breath and focus on what you know. And again, you're going to have your preceptor there with you that will guide you throughout the whole process. And again, you'll get better with time. Now, 3 things need to happen simultaneously. You have to let essential staff know that the full code is coming. You need to gather supplies. And when the staff gets there, you need to assign roles. So essential staff is your provider, ensuring they are aware and en route, your respiratory therapists, available techs, and fellow nurses that are able to assist with the code. Next, you have to gather the necessary equipment and supplies. So grab the crash cart, place it at bedside, and have the pads ready. Have suction ready, the bag valve mask ready, supplies to connect the patient onto the cardiac monitor, the glucometer, ECG machine, IV supplies, the IO gun, a pressurized normal saline bag, even the ultrasound machine. And the person on the crash cart needs to have the key medications that are given during a code ready, right? Already open and ready to be given. These are epinephrine, calcium chloride, and sodium bicarb. Again, if you're on the crash cart, they need to have these meds ready, the epi, the calcium, and the bicarb, and as well with the pressurized normal saline bag. Now, perhaps the most important of these to ensure a smooth code is assigning roles, right? Everyone needs to know what they're going to be doing during the code. So who is managing the crash cart? Hence, again, getting the meds ready and managing the use of the defibrillator. Who is starting the IV and or placing the IO and giving the meds? Who's connecting the patient onto the pads and the cardiac monitor? Who's doing CPR? Typically, RT or the provider will be on the airway, but sometimes if they aren't, who is on the airway, at least keeping a head, tail, chin lift and bagging? Who is going to check a glucometer, a glucose check for you? And you, as the primary RN, when there is adequate staffing, you will be at the entrance of the room with the provider, ensuring everyone is performing their tasks, and you are going to be keeping times as the primary nurse. Keeping times just means at what time did the patient arrive, what's their total downtime, when was the last epi, when is the next epi due, when is the next post check, and so forth. You're keeping those specific times, right? That's going to be your primary role. Now, before the patient arrives, you also need to communicate with your provider. You need to ask him, how often do you want epinephrine to be given? And again, it's typically going to be every 3 to 5 minutes, but you're keeping track, right? And then you have to ask him, how often do you want to do post checks? Or do they want to go off the end title? But you need to ask that ahead of time so that you know as you're keeping track. And then since you will be keeping the times as the primary nurse, you will also be in charge of notifying the team during the code when the next epi-amp and when the next post check is, right? So since you are in charge of the times, you coordinate this with your provider ahead of time so that they can focus on going over the H's and T's, on going over and trying to figure out why the patient coded, right? So now, what are some important questions we need to ask EMS after their report if they did not include it, right? When was the last epinephrine given? The approximate overall downtime. What was the patient's rhythm and were there any shocks? Was there any bystander CPR and how long has CPR been going on for? And although it should have been included in the report, if available, what's the story? Including like the events that happened right before the situation, patient's medical history, and any important details, especially family contact information, because we got to get a hold of their family, right? And then some overall tips are going to be, as a new ER nurse, you got to know what kind of medication you're in your crash cart and what they're for. You got to know what's in your crash cart and what it's for as well. You got to know how to defibrillate somebody, how to cardiovert somebody, and how to pace somebody. And you have to be proactive in doing a different role every time you're part of a cardiopulmonary arrest, so that by the time you are done with your preceptorship, you have an understanding of each task and each role. For example, you're going to be the person recording. You're going to be the person manning the crash cart. You're going to be the person in the room, placing the IV, placing the IO, giving the meds, getting them on the pads, doing all the room stuff. But you have to do each role during your preceptorship so you understand what happens as a whole. Now, let's go for the question of the day. It's a simple one. What does the acronym FAST stand for in the context of assessing a stroke patient, right? What does the acronym FAST stand for in the context of assessing a stroke patient? And if you would like to continue preparing and reviewing outside of work, go ahead and check out our books on Amazon. The links will be provided in the comment section and in the description at the bottom. And if you've learned something recently while at work that may be helpful to other new ER nurses, please consider sharing it in the comments so that we can all benefit and help each other out. Thank you. And as always, teamwork makes the dream work. And here at Emergency Chaos, we are proactive, not reactive.